Now, National Doctor Day is a day dedicated to honoring the hard work as well as dedication of medical professionals. Joining us for a closer look at the world of medicine through the eyes of a distinguished expert, Dr. Diki Budiman, staff of the Department of Foreign Affairs at the Indonesian Medical Association, or the EIDI or ED. Good morning, Dr. Diki.
Morning, Lisa Audrey.
Thank you so much. First of all, could you please provide some background information on National Doctor Day in Indonesia? How did this National Doctor Day come about?
So, Lisa Audrey and also the Indonesian community. On October 24th in 1950, the Indonesian Doctor Association was officially established on a valid legal basis, as I mentioned previously in your introduction. The inception of National Doctors Day also coincided with the founding of Indonesian Medical Association, which is considered as the medical professional organization where the leaders and members are only Indonesian doctor at the time and also up to now. And they are no longer, during our fighting to the colonialism, there are no longer any foreign or Dutch doctors at the time. And the National Doctor Days is a proof that the medical profession is a noble profession and is also a means for this professional group to maintain its noble tradition. That's the meaning of these National Doctor Days.
And so it's quite interesting that it is the founding of it, like you said, coincides with the founding as well of IDI, Ikatan Dokter Indonesia.
Yeah.
Can you tell us more about what IDI is, Ikatan Dokter Indonesia, especially to the general audience who are watching?
So, Ikatan Dokter Indonesia, or IDI, is the first and also the largest. Now I say the largest because now not only ED, the organization or profession organization to contain the doctors, but there are another based on the new regulation from the government. But ED is the first and the largest in the medical association in Indonesia, and also the member of the World Medical Association. The only representative of a medical association from Indonesia is IDI for the World Medical Association. And if we talk about IDI or Indonesian Medical Association, we cannot separate with the how Indonesia established or the many of our ancestor in terms of this medical association also involved in fighting colonialism and also in achieving the independence of Indonesia. Let's say Wahidin, Sudarosodor, and etc. And it is easier to recognize if we live in some certain city that usually the name of the largest or the government or public hospital in the area also use the name of the medical doctor who also fighting the colonialism, and also we call it the pahlawan or hero. So the wider roles of member of ED is very clear, and not only during the colonialism or during the Orde Baru, but even in the modern era. For example, me myself, I also have a role not only in terms of clinician, but now in global health diplomacy and etc., even in humanitarian aids. So this is the role that ED has take place. But of course, we as the profession organization, we are the we live among the community or public, and we selflessly to serve the public without and we can show during the pandemic era that many of our members also become the victim of this pandemic because they fight and they serve and they very committed in their or say their duty in serve the public, and that's very real proof that as a doctor we also always what say maintains that our profession is for the humanity and in terms of the public services.
Curious, how many members does Ikatan Dokter Indonesia or IDI have at the moment? And what is the goals of IDI going forward in terms of improving the medical qualities in Indonesia?
As the largest of the medical association, we have more than 100,000 members, but the exact number, I think, since we are now have several also other medical association, I have to confirm, but at least still in ED is become the largest. And one thing that Ikatan Dokter Indonesia or ED still keep up to now is that this association is aims is to also not only serve the community but also to help and also to maintain the quality, the ethics of our members, because in this modern era, ethic and we call it ethic public health or ethic in clinic is very important, because the era of globalization, the era of commercialization, it's one that we have to fight, because again, health is a right for any person, and in terms of this right, so we have to provide the qualified medical doctors with also have this ethic, because without ethic, so we will see many problems in terms of health practices, or we call it more malpractices, and that's what ED also have a role in this issue.
And in terms of developing or developments of more doctors in Indonesia, what is the specific role of ED itself? Let's say a doctor joins ED, Ikatan Dokter Indonesia, would they be able, for example, to qualify for more scholarships in order to get medical education or to be able to specialize in their fields? What are the specific benefits that it brings to the members as well?
So ED or Ikatan Dokter Indonesia has what we call it long life education. We have a training, a short course, and also maintains our members to keep update with the new knowledge, even keep update with what the next threat for the public health or the health of the community. So that's what we have. And the good thing of this ED, because many of our member, the senior member, is also the professor or the teacher in the medicine faculty. So this transfer of knowledge, updating the knowledge, is one that also use the teacher from this institution, education institution. And of course, one of the activity also we train the new medical doctors, the young medical doctor, before they send to the field or the community, by giving them more training in terms of let's say not only clinical but also the public health, and also again about the ethic. And of course there is also some opportunity to send our member to also have the short course or the training abroad, or even within the country, among the health education institution or faculty of the medicine. For example, as the also member of ED, I also send during my term in MOH, I also send some of the member of the ED to train in terms of, let's say, in Korea, the first, let's say, transplantation for liver, the group in, let's say, in Adam Rumah Sakit Hospital in Medan, and also the sent to for orthopedic training, then and also others specialty in Indonesia.
So there we can see there are so many benefits of becoming a member of the Indonesian Doctor Association, Indonesian Medical Association, or ED. Doctor, can we, if we can just go back to the National Doctor Day, can you share with us how does the Ikatan Dokter Indonesia (IDI) typically commemorate or celebrate the National Doctor Day?
So this week we celebrate in Lamongan, and also the celebration today is we want to remind all of us, I mean the member of this ED and also all the medical doctor in Indonesia, that we have to remember that our founding fathers, when they established this association or medical association, is to also follow the, we call it tradisi luhur. We should be embedded in our ancestor value and norm, and that's what we make it unique among other countries. And in Indonesia, even in medical association, we have this, let's say, not only ethic but also religious values, and also the gotong royong, and also the humanity. And this is very important because in era of this democracy, era of the freedom, many people think that, okay, we want to make what we want to do what we want do. That's of course it's okay, but we have to and we believe that we have to follow these national values and norm. And as the medical association, when we follow this, and of course the benefit will be for the public, because become a doctor is not only about the money or profit oriented, but there's a social responsibility. That's the value that also ED want to commemorate or remind to the members, and also all the medical doctors.
That value of social responsibility is really a noble value, I would say, and doctors have such a pivotal role in the lives of people, because really doctors save lives, and doctors really equip us with the best medical care that we need. And before this, Dr. Diki, you mentioned of how there are also some humanitarian efforts that are being done in IDI and possibly by yourself as well. Can you please elaborate more on those social humanitarian efforts that have been done in the past?
So in the past, and of course also we will also continue in the future, we involved with many disaster, natural disaster, humanitarian disaster, even the war victim and or the conflict. Not only, of course, not only within this nation, but also to going abroad. So, for example, I also involved with the establishment of the hospital in Gaza, Palestine, has also contributed by the government, and also I observed the development of the another Indonesian hospital, contributed by the Indonesian community, and also in many conflict. Let's say we also contribute in terms of this humanitarian aids. But of course, our focus is to protect and to serve the Indonesian in also not only within the country but also in abroad. For example, for our migrant workers in Middle East. So when they have a problem with their health issue, because they face this harassment and etc. I also involved with this mission to serve them and also to take them back to Indonesia. This is an example of how we involve not only within Indonesia, but also going abroad. And the last, I think the last disaster that the Indonesia faces is the, let's say, Cianjur earthquake. We have the team and many of our members involved during this event disaster, and I also personally involved in this mission. And that's, if we can say, this is there is no profit, there is no payment for doing this one. And we do this because we are as also the member of the community, and as the person or the community who has the health ability or health specialist, we serve this, and we use this skill, we use this knowledge to serve and help our community in crisis.
Now, Dr. Diki, speaking from your role as a doctor here in Indonesia, can you share how is the welfare and the well-being of doctors as well as medical practitioners in Indonesia at the moment?
Yeah, unfortunately, the welfare of the healthcare workers, including doctor in Indonesia, still become the issue. Of course, if I compare to my, my working place in Australia, it's very big gap. If we talk about the salary, about the the welfare of these medical profession, but I really grateful that many of my colleagues, medical doctor, is very have a high value and norm in terms of serve the community. But of course, if we talk about these needs, the basic needs, the house, the necessity for daily activity, that's we cannot reject, or we cannot say except from this need. So that's why the government has also responsibility to strengthen, improve the welfare, the quality, life quality of these medical profession, especially when we talk with the doctor who work in remote area, island, and also in let's say in the forest. And so this is something that Indonesia is still facing the problem so far. Of course, in big city, some profession has a good position in terms of welfare, but if we talk Indonesia, the majority of the doctors still serving the community indirectly, and not in the big city. If in terms for this unfortunate profession, when they face only when they duty only to serve the, let's say, community who has a low income, and also very difficult situation in terms of geography and etc. And of course, the other issue is also for them who work in remote area or in region, difficult situation. It's about how they can continue their education. This is not only about the responsibility of ED, but of course the main responsibility is for the government, how the doctor who work in remote area and also can have this opportunity to maintain or updating their knowledge, because the benefit will come to the public or the community. That's the problem. And the others also, we have a problem for the expensive of this medical education, and then that's also become a problem, because when we want to let's say adding more quantity of doctor, because our proportion of doctor between doctor and community is still lack and based on the WHO requirement. So this expensive of this medical education is become a very big challenge and issue. That's something also what the government should address this issue.
And so we can see from that, the thorough explanation, thank you, Dr. Diki, that there are several aspects as well that needs to be tended by the government in order to ensure that the needs of the doctors in Indonesia are also met. And on the topic of the government, during its ASEAN chairmanship, Indonesia played a major role in advancing the health sector in the region. The biggest country in ASEAN is committed to continue to drive forward the health sector in Southeast Asia. Now let's take a look back at Indonesia's achievements to push forward regional health architecture.
Indonesia has become the leading advocate for health issues in ASEAN by promoting the handling of infectious diseases, improving public health services, reducing the burden of disease, and increasing access to basic health services in ASEAN. On regional cooperation between ASEAN countries, Indonesia exchanged information, experiences, and resources in the handling of infectious diseases such as COVID-19 and Zika virus. Indonesia also boosts the capacity of health services. Domestically, Indonesia runs a number of health programs such as immunization programs and campaigns to prevent infectious diseases to lower mortality rate in patients. Indonesia has been active in mobilizing humanitarian aid to other ASEAN countries during natural disasters or health crises and will continue to promote health and welfare in the region after stepping down from the role of ASEAN chair last month.
Still back in our conversation with Dr. Diki Budiman. And Doctor, what can Indonesia do in particular to improve our regional health architecture? Because we know that at this current moment that there has been many initiatives done by the government, especially during our ASEAN chairmanship, in order to ensure that our regional health architecture is continuously increasing and for the betterment of doctors and for the public. So what do you have in mind?
So the good thing that I was also involved with the in ASEAN activities when I was as the in secretary of ASEAN. So in terms of this health architecture, we know during the pandemic, the Indonesia already showed that there's a big problem with this global health architecture and even in the region. Because, for example, in ASEAN country, the cooperation among ASEAN member countries is very lack during the pandemic. So each nation has their own vision, their own activities. But we forgot that during the pandemic, during the crisis, health crisis, we need the international collaboration. We need the strong, well-established health architecture in not only in the global but also including in the region, but even at the national level. That's what we like during the pandemic, and the idea, the idea from Indonesia in terms of strengthening the global health architecture is very great idea, and of course this is something that we have to keep maintains and also develop because this idea cannot realize in short term. It will require long-term activities and planning and of course budgeting. That's the classic issue for every great idea. And of course, if we talk ASEAN countries or region, if we talk about this activity, we know there is a big gap for this funding activity to support this health architecture idea. We talk about Indonesia, maybe Malaysia, and also let's say Thailand and Singapore. We can say they have enough commitment and also including the budgeting to support this idea. But the rest, they still have a problem within their national funding for health. So this is something that also why when we create this health our architecture, we need also to have this let's say health finding. Indonesia last year we have the what's say the pandemic fund. That's the good idea. The real activity that we need to support this great idea.
Now, Dr. Diki, going forward, besides, say, budgeting as well as funding, what can the government do to support the doctors in Indonesia so we can really improve our quality and become more advanced like other countries in the world?
Yeah, something that we still face now in achieving our goals to to putting Indonesia among others developed countries about the challenging in terms of geographical situation or condition of Indonesia, which is will need also the more widespread number of the medical profession, not only medical doctor but also nurse and etc. That's the issue that's still facing by Indonesia, because when we want to adding the number of medical doctors, again the problem is about the number of medical faculty. It's still concentrated in or located in Java Island. Of course, now we already show that many new medical faculty also established in other island, but still, if we talk about the east part of Indonesia, for example, there's still lack of this medical education or institution. And the other thing is about we need to also not adding more medical association, but also the quality of this medical education or university, because then we need a good quality of teacher, the good quality of curriculum, and also the infrastructure. Because of that, so we still need this, continuous support from government and planning and budgeting in adding this. Because again, the speed of let's say population adding, when with the speed of adding of new medical doctor is not in a balance, and that's the problem for Indonesia, because when we want to produce one doctor, at least we need 6 years. At least we need 6 years. That's, I think, the fastest one. Of course, when he or she graduate, the number of communities already adding more and more. So again, if we talk about Indonesia, we face a very complex problem, but I believe by combine the role of doctor, nurse, and other profession, and of course very important, the active roles and participation of public in maintains improving their health status, we can achieve this mission or our dreams.
So it's a interconnected effort, not only from the government, but also from the doctors, the medical professionals, and the public. Really great closing remarks. Thank you so much, Dr. Diki Budiman from the Indonesian Medical Association, or IDI. We want to wish you a happy National Doctor Day. Doctors are incredibly noble profession, and we really thank you for your service. And thank you so much again for your expertise and for coming on TVI World.
Thank you
Thank
so
you
much,
so much.
doctor. Have a great
Assalamualaikum.
day today.
Thank
Thank
you,
you. Stay healthy.